may have a community of people that are undergoing the same situation as you are. Like, and usually large companies have women's group, right? And you can find someone, I'm not saying to get medical advice from people that are not physicians, people that are not healthcare workers, but you can have a sounding board. You can create your own safe space. And that's where I think employers have like a bigger role to play, because they can facilitate those connections. And if there is a need that was identified, for example, diabetes at work, could we bring, right? Could employers bring someone who is an expert on a field to help to educate others?
Welcome to the Type 1 and Midlife podcast. My name is Melissa Slemp, a certified nutritional health coach and the founder and CEO of Abundant Health with Melissa, where I help women with type 1 diabetes to feel more empowered and live their best life despite their diagnosis. Each week, I will bring conversations and strategies from guest experts and my experience living with type 1 for over 40 years now. So if you're a woman ready to redefine how diabetes can look and feel for you, then the Type 1 and Midlife podcast is the show for you. Today, I am thrilled to have Jaqueline Oliveira-Cella as our special guest. With over 15 years of experience in healthcare, employee benefits, and well-being, Jaqueline brings a wealth of knowledge and expertise to the table. She's currently enrolled in the Harvard Medical School Global Healthcare Leadership Executive Program, and she is not only an executive leader, but also the founder of wellBe Consulting. And Jaqueline's passion lies in shaping health solutions for thriving employees and focusing on mental fitness, well-being, and business growth. And through her nonprofit social initiative, Health at Work, she wants to share practical information to help employees stay healthy and make companies more sustainable. In her career, Jaqueline is known for focusing on clients, building partnerships, and measuring success. And she leads with openness and trust and empowerment. And in today's episode, Jaqueline will shed light on the challenges faced by women in the workplace with diabetes and during menopause, and offers insights into advocating for ourselves and fostering supportive work environments. So stay tuned for an important conversation, and please share this show with other ladies who need to hear this. Enjoy. Nothing you hear on this Type 1 and Midlife podcast should be a substitute for professional medical advice. Please always consult your doctor before changing your diet, insulin dosages, or healthcare plan. Well, hello. We are back in here this week, and today I welcome Jaqueline Oliveira-Cella. So happy you're here today. Did I say that well? Beautiful name. Nice to meet you.
Better than how my husband pronounced my name. How does that sound?
I'll take that as a compliment. Yes, definitely. This is a very important topic. And today we're going to dive into something that you are very passionate about, and that is just creating the awareness and improving the workplace health and wellness for women. And today we're gonna kind of touch on obviously through menopause and or living with diabetes. So there's going to be a few little pieces to this, but we're going to unpack it. So tell us a little bit about yourself and what got you into all this. Why are you here, and why is this your passion?
Thank you for having me here. So what brings me here is the opportunity to share with others, to give others a voice on how to properly articulate and manage a top health risk condition, like a top health risk concern within their workplace. So that's how Health at Work, the social impact branch of my work, started. I have been working on developing offerings for employers. Either I'm an actuary by background, and I have been working on longevity, life, disability, healthcare, and health at work brings it all together. So when you think about people risk management, what health at work does is it's a collaboration to start with. It's public. I have been publishing via LinkedIn, so you can find those collaborations. I believe that it's labeled as newsletters, and the focus of those collaborations are top health risk concerns that impact employees and employers. So it's usually the way I create. I'm a data-driven person. Given my background, I believe in evidence-based and data-driven insights that can help us to co-create solutions. So usually, I start with, why are we talking? Right? What is the why this topic is important for employers, right? And for individuals. Then I delve into financial impact, non-financial impact, health equity, which is a passion of mine. And then going to what is the path to solution? And usually it's not a one single strategy. It's a multitude of strategies that can be put in place, and every company is different. So part of my work is to advise healthcare solutions and payers or point solutions in the US on how to craft or how to design their product in a way that's impactful for employers. What metrics are you using, right? And with that, like that you see within, like reflected upon my social impact work. Because I try to go, as I said, why I'm talking to you, what happens if you do nothing, right? So the financial and non-financial impact, and then the path to solution that usually includes awareness, cultural shifts, right? Empowering with knowledge and care, right? Identifying the unmet needs for that particular risk. So, for example, I started with digital healthcare transformation back in 2022, then used the power of stories to tell my own journey, my family journey through healthy heart. And then moving to menopause at work, mental fitness, and I'm being short here, diabetes at work more recently, our relationship with food. And the last one was a deep dive into burnout, focus on healthcare workers. But the strategy can be applied to any employer. So the way I can share, how can you use health at work? Use to educate yourself and be able to advocate, to be curious, right? Not to be military. Not all companies will be able to afford all the best practice, but there are simple things. Like when I was looking into, I will talk about menopause at work. One of the best practice, it could be simply be nearby a water cooler, be nearby a place with ventilation. Right?
Understood.
So there are accommodations that are not that costly. I'm not saying that's the one thing that the employer should do, because that's not it. But there are things you can evaluate what makes sense to your company. And I will pause.
I know it's so many layers. And you know, it's funny, when we started before we hit record today, I was thinking of obviously some of the things you brought up, but the more that you mention, the more I think about all the different layers of this. is it because you're advocating for the whole system? I mean, and obviously it's the employers and the employees that are infected or are impacted. Where do you generally see where the flag's being raised? Is it coming from the employers, or the employers saying, gosh, I'm noticing there's a difference to my bottom line, productivity, employee morale,
Hopefully they,
all those things? Are they noticing it? I mean, obviously, and then we have to look at ourselves as women in the workplace.
yeah.
Are we aware of it? Are we putting it all together? So yeah, there's so many different things to kind of point to when you say that there's a lot of solutions to the problem. But I think maybe the first thing is just recognizing long term how important this is to address ASAP.
I love that question.
Right?
And
ASAP.
your question on itself has a lot of layers.
I know.
So let me see.
Yes.
So how do I identify? Let me know. I'm playing this back to you.
Absolutely.
How do I identify topics? Right. For example, how do I say what risks to cover? So I started with from my experience, when you're looking to medical claims data and prescription drugs data in aggregate, you can pretty much, and this is not just the US, globally speaking, you can identify certain top health risk concerns, right? So where cardiovascular disease is across the globe on a top of the list, usually paired with diabetes, usually paired with more recently even like musculoskeletal diseases. Depending on the country, the order changes. Mental health has been increasing over time, but mental health, it's a tricky one because depending on the comorbidity, one commonality that I saw across every single disease, like healthcare condition that I have had the privilege of studying, of researching, is that mental health is impacted across, particularly if you're talking about chronic illnesses. It's mental health should be part of the conversation for every single of the different health risks. It's part of it, right? So when you think about someone passing through in menopause, the reason why and then I have topics, so top health risks, and then secondly, I have topics that bring it out together to some extent, that focus on a gap that's so on our, I would say, on our face.
Right.
And you
staring us in the face. Yeah.
Staring at us, and you look at demographics. Demographics are telling us, I'm referring to menopause at work, right? So as I was, I had an amazing partner when we put like menopause at work together to brainstorm what should I do during the Women's History Month, and here we are again, month of March, to that would be impactful to us. We are women, right? Let's be real. It's on us. So, and while I thought about looking in prevention of cancer, breast cancer, obesity, management as a condition, not as a choice. And we can talk more about that maybe on another episode. And then there was something that I started working back in 2021, 2022, which is addressing some of the women that from my prior employer, they approached me to ask for help. They say, and the UK has been very, the United Kingdom has been a little more advanced on studies related to impact of ignoring menopause at work. And so for me, it was a personal matter of closing a chapter, right? Of giving the voice to all those women that came to me to ask for help.
Okay.
So that's the long answer to how the topics are chosen. And then the other topic that will continue to come, because I will make sure that we are addressing health inequities. It's something that's really relevant, I think, for all of us.
Okay.
Health inequities and workplace, let me put on a positive spin, workplace equity and health equity. Those are topics that either will be part of the healthcare at work or I stand alone. Right?
Okay. Well, let me ask you. Let's we'll back up. This is such a good topic, and I just love. I love diving into this. This is something I haven't had on my show. I know that women, obviously, over 40 is our average age here in as far as our listeners. So I know that this is really going to sit with them. I really think that this is, and this may even be something they're not admitting or talking about. And that's another whole conversation because I used to be in the corporate setting. I've shared this with you before. I've always been type 1 working. I was diagnosed over 40 years ago. So I worked for years in a corporate type atmosphere. And I was not in menopause in that time. I was, my 30s and my 40s. So it was a different stage hormonally for me. But diabetes for me, and we'll just jump to diabetes because it's an example of what you're talking about. And we'll talk more about that as the conversation goes. But it was something that I hid, I was ashamed of. I minimized it because, and this is probably the same sort of reaction that many women are expressing when it is menopause is that I don't want to shine a light on this. I want to handle it the best I can wherever I am, but especially in that high pressure atmosphere of work where productivity and our mental capabilities and our, just contributing to the success of a company that we're working for. And to be seen as weak or weaker because suddenly things are changing with us medically and hormonally. And I know that I did experience that with diabetes. I had a handful of throughout the years, I had a handful of episodes. I'll call them episodes, low sugar episodes. And I've been very transparent about that here on the show and with my followers. And part of that was because I wasn't being honest with my disease and giving myself the time and attention while at work. And that led to issues. And obviously, when I wasn't paying attention to falling blood sugar while I was at my desk working, I was soon passed out at my desk, not working, because I was passed out with low blood sugar. So again, this is an extreme example. But it goes to show you that when we're wrapped up in that busyness and that level that we have to keep going, that our health and taking care of ourselves is not always our first priority. And that's bad for everybody. Not only
Absolutely.
was it, I can look at it in a positive way. It's a learning experience. I grew closer to my coworkers, believe it or not, because I was able to be, a human, which is what I am, because we do falter and we do make mistakes and things happen. But it's interesting because I have not been in a corporate setting through my menopause, perimenopause, through postmenopause, which is where I am now. So I don't know what that's like right now, but I can only imagine. Yeah. So,
and I would love to hear from the entire audience.
Yes.
Right? I would love to hear. Please engage, and I would love to hear more. I continue to update our health at work edition on menopause, focusing on menopause at work. So you mentioned about our health, it's private. Let's
Mhm.
start with that.
That's so
So you
true.
have the right to disclose as much
That's
as you feel comfortable
true.
with. And I'm not recommending women or any individual to be authentic, meaning that that's not the same as being authentic, disclosing your health condition, because unfortunately there are biases that are created,
Yeah.
right? As a result of that. Now, it was also, so what I would do in a situation like that, and I loved that you mentioned I got closer to my workmates. I got closer to the people, to my colleagues, right? So what I would say is disclose with the circle of people that you trust. Make it as matter of fact as possible. Right? And that's for both, like, yeah, I know we are touching on both diabetes and also menopause, but learn and rehearse. Like for menopause in particular, rehearse what to say if you happen to have a VSM, like one thing, like if you happen to be one of the lucky ones that cannot sleep at night and on the next day may need to have flexible working hours, if that's something available to you, or if you have a hot flash in the middle of a meeting. Rehearse what to say. Get the language, and please look up on the Health at Work. I added as much as I could insights on what other women, how other women are positioning themselves. But other than that, it's also learning, tap into your BRG, your DNI groups. Perhaps you may have a community of people that are undergoing the same situation as you are. Like, and usually large companies have women's group, right? And you can find someone. I'm not saying to get medical advice from people that are not physicians, people that are not healthcare workers, but you can have a sounding board. You can
Some sort
create
of
your own
support system.
safe space.
Yeah.
And that's
a great
where I
idea.
think employers have like a bigger role to play, because they can facilitate those connections. And if there is a need that was identified, for example, diabetes at work, could we bring, right? Could employers bring someone who is an expert on a field to help to educate others, not educate people with that has the condition, right? When I see things like, not to deviate too much, but Awareness Day, like or the International Women's Day.
Right. There are opportunities nationally that we are recognizing diseases and states of celebrating the awareness. So employers can take advantage of that.
You can take advantage
to focus on it.
Or just add as part of like what they are negotiating with the healthcare providers. Add. Those are the top health risk concerns that are important for my employees, and I want to make sure that they have access to timely and actionable education. I don't need a lecture. I need something that I can bounce my concerns. And ultimately, if you create that environment of care, you build trust, and trust builds opportunity for people to innovate, to be the very best version of themselves. Does it help?
Yeah, I love that. Yeah, it really is about just taking that step. Really, it is. So how many companies now, I don't know if you, and you don't have to give me statistics or numbers, but what do you think is the, what's going on right now with the bigger companies? And again, we don't have to mention names of companies or anything like that, but what's the feel for this topic among the corporate setting?
All right. So
what sort of,
I see way more. So from let's say last year to date, I see way more talks, more openness. Like before, I remember I'm going to when I
Love a
created,
story.
like when we developed the menopause at work briefing, I got a question from two different people, two different roles. One is a friend came to me and said, "Why are you writing about menopause? You're too young." And I was like, menopause can start like the average age, if I'm not mistaken, is mid 40s, right?
Absolutely. Yes.
And the average age of hitting menopause, so perimenopausal mid 40s, 51, 52
Absolutely.
menopause, and then 1 year later post,
Yes.
and so on. But there are women that has as early as on their 30s or even earlier, depending on medical
Sure.
condition. So that
Sure.
was one interesting comment that I got from a friend.
Yeah.
Then the second one, and I will mention a third. The second one was from a CHRO, which surprised me, right? Because things changed so much since then, and lucky for us, because when I talked to this particular leader who I admire, and she was sincere, and she said, "I don't think I can get the buy-in to invest in menopause care at work because my population is too young."
Oh, interesting. Okay.
Yes.
Okay.
So
I was like, just relating that back to her own workplace situation at the time.
And
interesting.
that in itself has, I said, well, but you hope your company is going to survive. Like demographics are telling us, women, normal retirement age is expanding. We are having less babies. And the average, like the age group that's growing faster are women that will be hitting menopause while on a corporate setting, right? So it's short-sighted. That's my response to a situation like that. But obviously, companies need to prioritize. And again, culture, empower with knowledge, right? Awareness and care. You don't need to do, you can do as much as your company can afford, but by helping individuals, regardless of the age, to understand the different stages of life, right? You are helping them to have a conversation with their spouses. You are helping them to have a conversation with their parents or someone in their life that may be passing for something like that and don't even know. And that's another issue with menopause. A lot of women, they think they are developing Alzheimer's or other conditions, right? Because they were not able to recognize that it was actually that they are passing through perimenopause. And then the third is that something that's super positive is within my inner circle. The moment I published this particular study, the number of people that started talking about it within my inner circle, with other groups, I received messages from leaders that I admire saying, "Thank you for this briefing. Like, thank you for making the time to have this voice." Because sometimes if you talk to a male, they may cringe on a topic. It's like, you cannot say menstruation, you cannot say menopause, and people have a shock. And why is that? Because they are not used to. Make it normal. Make it as, it's not again to be shouting, "Hey, I'm on menopause." You don't need to. It's more about how sharing, like with boundaries. Sharing to say, if this, let's say, if you happen to have hot flashes in the middle of a meeting, you may need to, again, everybody's different, but they had this very interesting study on how people perceive women passing through hot flashes in two different settings. one setting, the woman was able to properly articulate upfront, if I happen to stand up and go get a glass of water, or pull up a fan, or open a window, if that's, let's continue the meeting as is. This is what's happening. Like being matter of fact. It's I'm just having a menopausal symptom, or whatever the way that you feel comfortable in sharing, but making sure that this is not going to impact my way of working or performing.
Right.
And then the other group, the women suffered in silence. Which of the two groups do you think, two situations, do you think people said, what people said about the women? Executive presence versus sloppy, lack of hygiene. That's what we get by suffering in silence. Right? So it's like,
and I think those
hear the shame.
Right? And it's funny. I don't mean to interrupt, but it's stigma and those assumptions that we can have, and this can happen anywhere in life with people that we come in contact with or work with, but it really is about just mentioning it and just mentioning it, having that awareness. And I think that helps women with the feeling valid that this is not the end of it's definitely not the end of their life or their woman, their vitality. And it shouldn't be shouldn't be a dent in their ability to perform at work and to do what they've spent so much time creating and fine-tuning and education and all the things that they invest in. I love that idea that it's really just about saying and you mentioned the phrase before, just to be matter of fact about it, because that's what it is. This is not going to go away. This is reality. Let's, as people and coworkers, recognize it and give it some respect and, give it some respect.
And accommodate, right?
Yeah, accommodate. Yes.
Yeah. And again, the tricky thing with menopause is, like, and I heard, if you are in a corporate setting, it's likely that you are on that beautiful stage in your career, right? That you are growing within, like, you have had already a few decades in the workforce, right? So you are developing seniority. You're becoming you may become a VP, or it's whatever that career progression is.
Yeah, absolutely.
And then you have your kids, if you happen to have kids that you are caring for, parents that you're caring for, and the family, right? That's usually what happens with women. And then you have this cliff jump on hormonal change that impact you. So don't allow that to be, let's say, to be your roadblock for success. That's if there is one thing, it's like educate yourself on how to talk to your doctor, which questions to ask, which it's how to engage your employer to educate others within your organization. So it's not about you, it's about how to cascade knowledge on different life stages.
Yeah.
And hopefully school settings, they should soon label as it's a stage of life. To be honest, now being for women, it's like, after you pass through, I should not joke about that, but I will. It's like, I'm no longer menstruating. Yay!
Right. It is something to celebrate, right? Yeah.
And it's I'm sharing my own version of it. And find care, right? Look for care, seek care, be curious. If by any chance your doctors dismiss certain symptoms
Mm-hmm.
that are
Mm-hmm.
associated
Mm-hmm.
with menopause. And on a briefing, we had some beautiful physicians sharing and studies sharing what are the most common symptoms.
Mm-hmm.
Well, maybe it's time to find a new doctor. Like,
Yes.
or to
Yes.
ask asking the right questions, bringing the doctors on your journey, developing that relationship of
Absolutely.
trust
Big
with
believer.
them.
Mm-hmm.
I have added to today's study, because I learned as well. There is something called NAMS, the North America Menopause Society. Hopefully, I'm
Okay.
not
Uh-huh.
messing up with the
Uh-huh.
acronym, but they actually have a list of physicians and other healthcare workers who are specialized in menopause.
Oh, very
So
nice.
you can
Very nice.
cross-check that with your in-network, right,
Mm-hmm.
list of providers, and
Mm-hmm.
perhaps find someone um, that's it's near lives near, something someone to
Something
help
that's
you, right?
right.
Yeah,
Something that's
that's
accessible. Yeah, to you.
exactly. Thank you. I was looking for
Yeah.
that
And
word.
I know sometimes we miss the words. You know, and you mentioned something too about like the employer that you that had the comment about your study, that said that it didn't pertain to her work environment right now, that the age, um, the average age of the women wasn't in menopause yet. But what you were just saying too just makes me think too, because I'm all about education and prevention and equipping women, not only when they're going through this stage, but before they even get there, because that is really what's missing. And again, we're getting a little off topic with diabetes, but we will come back
And go
around with
back.
that in here. Yeah, this is definitely, because this is really the same woman, because I've experienced obviously type 1 diabetes in menopause, now post-menopause, and it can feel like a train wreck. So I cannot imagine if I had been going through this and working in a corporate environment without any sort of direction of a doctor that's going to support me. Natural ways to get through this, with lifestyle, which is what I coach, and hormone replacement therapy, which I'm a big believer in. These are all things that they need to be aware of and accessible to. And it is something that their workplace can connect them with, and doesn't necessarily have to be connected through the workplace, because that may seem a little funny. I don't know if HR and their medical, all the
They're
different
healthcare
levels.
providers. They're
Yeah.
healthcare
Why
providers.
can't
If
they
they
provide
happen
this?
if you are lucky one to be working for a company, you asked me about employers. Yeah, employers are doing more and more based
Yeah.
on their affordability. Microsoft
Mm-hmm.
a few months
Mm-hmm.
ago was
Yeah.
mentioning, for example, they have, and their technology, I don't know their average age,
Mm-hmm.
but
Mm-hmm.
they are supposedly they have a good chunk of younger population as well.
Mm-hmm.
So my prior employer, Kindle, they in other companies are doing things too. So I see more and more companies taking action. The
Yeah.
same
Being
way that, for
proactive.
example, with being proactive, and why part of why they see the responsibility, because again, you create by creating the care that employees need.
Mm-hmm.
Employees can be at work, right?
Mm-hmm.
They will be healthier.
Mm-hmm.
They will be building a relationship. I know it's a much bigger story when we talk about trust, but I recall vividly during COVID, and I think anyone who was working to help people be healthier during COVID-19, like during the past few years, like
Mm-hmm.
at the end of the journey, you're talking about caring for oneself. I was myself on an edge of burning myself out, and not to
Mm-hmm.
deviate too much, but what I'm trying to say is, even when you have a solution that does not necessarily impact an employee, but
Mm-hmm. Mm-hmm.
impacts their peer impacts their colleague, and you never know the future. It could impact you as well.
That's right.
That creates, and I mentioned COVID because I remember an engagement survey that was done after we had implemented this holistic array of strategies to help employees to be whatever best they could be during the situation. We had a 4% increase in the engagement survey in the middle, of the storm of COVID-19 storm. And some of the comments were associated with actions the company took to help employees who are navigating, who are caregivers. And some of the comments came from people who are joining and did not have kids. Right? So it's like you create an environment that people feel cared for. Right? So that's number one. Of course, you need to prioritize where you need to invest your monies. And the other point that hopefully more and more employers will realize, the way our healthcare system is built, in the US and in a lot of countries, it's to take care of the sick. Yeah. It's reactive. It's not proactive.
Yeah, absolutely.
Right? It's not really it doesn't. The prevention piece of it, there is a lot of talk. Like if you want to tap into menopause and diabetes, and you will need to jump here and help me. But when I think about nutritional companies, that's a very common topic that companies from time to time have nutritional campaigns taking place. But here's the problem with the nutritional campaigns. Fantastic information, but do you really think that people eat on what's considered unhealthy food because they want to be sick? It's not just about the information. It's about what's your behavior? What's your relationship with food?
Yes.
So
it goes much deeper.
Correct.
Absolutely.
So it's even looking into what are the type of targeted interventions that you have on your employer. Are they really resonating with people? Are people responding to it, or just ignoring or saying, okay, great, but I still go to my free snacks session of the company, and then I have M&Ms being served.
Right. So contradictory.
Nothing against, I think no judgment.
Yeah,
but if you were trying to create a culture of health, you need to be model
completely on board. Yes. That's right. That's right. We should have some fruit and some fruit instead of M&Ms.
But they had the fruit. They had the fruit. But
you're
what
right.
People would have.
Oh, you are right. This brings back a lot of memories when I was working in a corporate setting. Yes, there was always those. There was always those choices. But we're tempted by, the sugar and the sweet, and not to mention the environment, and maybe it's a stressful day, because that's just, one thing leads to another with, just how we're feeling that day. And that's going to satisfy us much more than the apple will, at least
I love what you just mentioned, because one of the questions that as I was researching on our relationship with food, right? So one of the you need to find a way to create a thought-provoking, let's say, situation, so you can find your own internal driver to take action. Right? So in talking about I cannot say that I'm on the same shoes that you are, for example, with diabetes management. But I have an idea of the complexity that is. Good thing for CGMs, right? The technology is helping to manage, but it's a lifetime of work, right? And thinking about how to manage the mind, mental health, plus physical, exercises and food. You are what you eat. It's very true. But sometimes, like I used to joke, if I allow myself, like maybe I should say that 6 months ago, um, I could eat any emotion. Give me an emotion, I will find you, and I a comfort
Right.
food to go
Thoughts
with
are
it.
so powerful. Oh my gosh.
And
Yes.
and then what happened was I you eat without even realizing what you're eating. So
Mhm.
sometimes, at least for me, it helps to feel my body and see, am I satisfied? What is on my mind when I'm eating? And I am
Mhm.
I snacking in front of a TV or in front of something that I'm just like, it's mechanical.
Mhm. Yeah.
So
Yeah.
they are, not
Yeah.
to deviate too much, but that's when I think about the nutritional campaigns, it's combining. And for
Mhm.
honestly, for every single campaign, heart, healthy
Mhm.
heart, diabetes management, um, obesity management, you need to combine with mental health care. You need to
Absolutely.
combine with mental fitness.
Yeah.
And mental fitness, it does not mean that you're going to therapy and that's it. It's a daily work. It's
Right. Right.
habits
Right.
that
It's
are over
practicing it.
time.
Mhm.
Yes. And we,
Practice.
we can
Practice.
all do, right?
Yeah. Yeah.
Um,
Absolutely.
so
So
tell me,
yeah.
like, have I addressed your,
Yeah, absolutely. Yeah, we're going all around, and I love this conversation. You mentioned some things that you've already touched on some things that business owners can help to, what they can do, help how they can support, maybe get this initiative, or not maybe, but get this initiative into practice within their business model. What about employees? Where do you think it starts with those of the listeners here that are either in perimenopause, over 40, working in the workplace, and this is really starting to kind of, all of what we're talking about is ringing true for them, but they're thinking, okay, so now what should be my next step? I am struggling with X, Y, and Z. I'm having a hard time being forthcoming with my medical, I'll call it a condition, I'll call it the state, diabetes, and specifically for women here that live with both diabetes and are approaching menopause. And that is a wide open question, because I know, just like I coach, it's so different for everyone. It's not the same answer for everyone. But I think in the scope of what we're discussing today, within their time at work, what can they be doing differently to get what they need and to still feel vital?
yeah, love that question. Well, they are vital. It doesn't matter, like age needs to be,
Right.
we're all vital. Uh,
Well, feel vital.
we're
I,
not
I
alone.
think that's the,
So
and I think that is, and maybe that's the reminder. I think when we're caught up in this hustle and bustle of the work, because like you mentioned it as well, we're juggling so much. We're juggling family, whether kids are home or they've left the nest, aging parents, finances, taking care of a home, pets, it goes on and on and on. And then we're supposed to show up and be like we've always been, like in our 30s, when we were kind of in our prime. I think my 30s and 40s was really when it's a different stage, but definitely I think that was the prime. But
today
to
is my
really,
prime. Now,
and again, it's
talking
all
to
about
you.
it's all about the thoughts. It's all about getting that mindset that, it's okay. This is going to be a different time. This is going to look and feel a little different, but we can get through this. But I think, yeah, what advice do you
So
have?
I start with, you're not alone. As simple as
Mm,
that. You are not alone. 50% of the population will be passing through menopause.
mhm.
If you're lucky enough, you will be passing through menopause.
Yeah.
Okay. And call it something else, call it sleep hormone, whatever that is. It's just a passage that does not need to be like, luckily, there are ways, like, of caring for if you have severe symptoms, and you have hopefully the health at work will give you enough language, but if not, start be curious. So number one, you are not alone. Have self-compassion, like it's a muscle. So develop self-compassion for yourself, right? You are worth
Mm-hmm.
it. And then the you are not alone can be paired with, you can find, if you can find a community and build a relationship with a community that's passing through the same situation and may have directions on, or what, not medical directions, but more so, I like, this is a study that I have seen, or this doctor has
Mm-hmm.
helped me,
Mm-hmm.
or and so on. So find, you are not alone. Everybody, it's something that should be treated as part of life. It's natural. Make sure that you also, once you have the opportunity to educate yourself, have a conversation with your family, have a conversation with your close circle, so they can understand what's
Mm-hmm.
happening. In one instance, someone close to me said the person who actually identified, after she had gone through a lot of different medical exams, the person who identified that she could be on perimenopause was her spouse, because she thought she was developing
Right.
Alzheimer's or something like
Oh,
that. She had
wow.
gone through several tests and nothing. And
Interesting.
voila,
Yeah.
that
Yeah.
was exactly like she was
Yeah.
having one of the symptoms of,
Yeah.
like, that may come with perimenopause. So find, like, create your inner circle. You are not alone. Then educate yourself on what other companies are doing. And
Mm.
if you are in a corporate setting, you may use that. To be honest, this is why I constructed those the health at works collaborations in the first place. You can get that article and go talk to and or
Mm.
share with the CHRO of your company,
Mm.
or with the your people manager, right? If you don't feel
Mm-hmm.
comfortable reaching
Mm-hmm.
out to HR, because they may be able to tap into their own resources with the healthcare solutions, and healthcare solutions are getting better and better at
Mm-hmm.
addressing those targeted
Yeah.
needs, um, and bring educational awareness and care to your corporate setting.
I love
And
that.
that's on
Yes.
its, so
Yeah.
it's like educate yourself, not just for like, and think about, you will be doing a service to all the other women who may be passing through the same situation
Uh-huh.
in a
Know that you're
job.
not alone. Yes, yes. And you mentioned that a couple times, and it's so important to know that you're not the only one going through this. Let's wrap our arms around this stage. And and even if there's so many different scenarios that could lead to this discussion, like you say, with HR, with your manager, obviously your family, obviously that's going to be a family conversation, but it's good to have the language, like you say too. And I know your study and your article is really going to help support women on that too. That's definitely something for them to tune to. So, yeah.
Yes. And collaboration, like I talk about creating your inner circle. One of my biggest joys with the health at work is the collaboration, right? That you get, in my case, from healthcare experts. I'm part of
Mm-hmm.
the Harvard Medical School Global Healthcare Leaders Program,
Mm-hmm.
which is on itself creates a community of of people that are interested in seeing other individuals healthier, that
Mm-hmm.
are
Mm-hmm.
taking action towards innovation in healthcare. And if you look at the some of the more recent articles, we have collaborated together. So why do I mention that?
Mm-hmm.
Don't, you're not alone. Don't underestimate, like a dear friend of mine says, don't underestimate the power of the pack, because you can
Mm-hmm.
find care if you need, for example, additional help, right? You should be able to find mental health care that's something that will alleviate and you bring your mental fitness in check. And this is for all genders included. But the power of pet, you can help each other.
Yeah,
right?
I
You
love
can,
that.
I
Absolutely.
truly
Come
believe
together.
you can help each other and you can help to find education. I remember, I don't know, do you remember the time of the encyclopedias where we would have like several books?
That is where we learned, isn't it? Yes.
Nowadays,
it's
you can,
instant.
Too like the doctors like to say, Google doctors. You type it in, or like you search on the internet.
Right.
Not all reliable, but at least it gives you a little bit of knowledge so you can have an intelligent discussion with your doctor, right? Or with your health coach.
Yeah, really good point. Yeah. And something I wanted to mention too is just how important, like you say, to stay connected with your healthcare team and to get those hormone levels checked, ladies. I think that is something, like you mentioned, the friend that you were speaking with that didn't realize that she was in perimenopause when she's experiencing these symptoms, because many of the symptoms, and they're different for all of us at different stages, but we can point to other things. Oh, well, it's this. Oh, it's the stress. It's, my kids are in high school. That's why I'm feeling this way. All these different things that we can, and all that's probably happening, that's for sure, but it's our response to it. And if it's out of the norm, talk with the doctor, get a full panel of your blood work and your hormones level done. And if they're fine, they're fine, but at least know and just kind of check that box, because I'm very data driven like you are. And I know that's the way we are in this diabetes space. We are used to the A1Cs and, all the things, the time and range that we have to keep a track of. And all of that's pointing to how we're feeling. So it's real important to understand the foundation of really what's going on. So really good point. Really good point. Yeah.
Beautiful. I love it. And I hope this helps your audience and they share with others that can be helped. And if they have daughters or they are caring, like they can talk to their moms, they can talk to their daughters, because it's important. Like the generational gap of knowledge is something that we passed through. At least I did. I never heard the word menopause until a few years ago.
Right. Understood.
Hopefully my daughter will know, because I have said to her several times what that is. And we will continue to just make sure that we are advocating for ourselves in a way that's seen as intellectually sound, that's seen that's seen as simple as it's part of life.
Yeah.
Right?
I like that.
Part of life. And it doesn't mean that it's part of life and I'm doing nothing about it. It means it's part of life and I'm caring for myself.
Right. It's not going to take over or control my outcome. It's something that I can help steer, for sure. Nice. So the Menopause at Work study that you launched in 2023, I know this is an ongoing project study that you continue to update, and because change is going on. You've talked a lot about that today. So what are you working on right now as far as that study? What can you share with us?
Yeah, so for the Menopause at Work, the last time I'm continually updating. So the questions that you can ask your doctors were updated based on feedback that I got from physicians. I also added some interesting numbers, like if you need to have a conversation with your employer,
I like it.
from the Mayo Clinic study, and then also a women's health study, an actuarial study, showcasing two things: the cost of misdiagnosing menopause, of not
Okay.
caring for menopause. And the
Mhm.
second study shows that there is a misdiagnosed, that 20% are diagnosed versus the expected to be 40% to be
Mhm.
diagnosed. I know I'm like giving just flowing numbers, but the
Yeah.
message is I continue to update what I see changing. And again, I'm biased because I'm in this
In it.
project for a while, but I see way more talk, way more people getting educated about it and knowing what to ask for. Right?
Mm.
So that's really positive. Now, I don't have stats on the number of companies that are including specific menopause care as part of a women's healthcare
Mhm.
point solution. But
Mhm.
I see at least the Fortune, within the Fortune 50, Fortune 500 companies, more and more companies are announcing that they are including as part of their package.
Okay.
So I cannot say that's like only focus on menopause is the majority of the companies are doing. But I can say that women's health, it's something that it is being included. So that goes from menstruation to menopause and
Okay.
health, right?
Okay. So the whole reproductive time.
And mental health, right? Mental health, it's
Yeah, it starts
also
with that.
helps. I
Mm-hmm.
that's lucky for us. It's one
Mm-hmm.
piece of
Mm-hmm.
the equation on mental fitness.
Yeah.
It's having access to care.
Yeah.
The other is culture. It's ways of working. It's that
Mm.
what is like even understanding what compassionate leadership means to a company. It
Mm.
doesn't mean it's quite the opposite of being a weak leader. It's having the
Mm.
courage to say
Mm.
things with integrity. It's having the courage to have difficult conversations and having the intent to actually help people to succeed, right?
Mm. Kind and loving.
And yeah, so
Yeah.
when you're asking about what's next, so I continue to update the menopause at work. I continue to research data on compassionate leadership and the connection with business results, for example, and
Mm-hmm.
how teams perform when you are under a compassionate leadership management. Walmart just had a few days ago, very interesting, that they are training their managers on compassionate leadership. Beautiful. And
Nice.
third, my capstone project at Harvard will be focused on care coordination, like a path of care or the gaps on path of care for women passing through gestational diabetes. So
Mm-hmm.
that's
Mm-hmm.
that's what's next.
Yeah, I love it. And I could tell this lights you up because this you see the need, you've experienced the need, and you're here. This is your will. This is this is
Yes,
your purpose.
I
Really
I love the
appreciate that.
work in as many
Mm-hmm.
healthcare companies that I can help to
Mm-hmm.
actually craft their solutions to something that's of impact to employers. That's when I think about life mission. That's my life
Mm-hmm.
mission,
I love it. Very nice, Jacqueline.
and all of us will benefit from it. That's
Yes,
how I see.
yes. So, and it sounds like I was going to ask you what still needs to happen. It sounds like you're already in the progress. Obviously, there's,
Research.
yeah. Oh,
Research, like
yeah.
clinical research for like, and we saw some movements, like humble movements, on research for women's health. If you are not if the audience is not aware, I think it's mm, maybe 20. I'm trying to
Are you talking about the Women's Health
30,
Organ?
about 30 years ago, women
Yeah.
were not part of clinical trials,
Mm-hmm.
and certain health risk conditions, including cardiovascular diseases, present itself differently in women versus men. But the
Mm.
medications that we have today in the path of care is it's based on drugs that were like clinical
Man's
trials that
needs.
had predominantly males. So
Yeah.
we will
Okay.
see more. I'm hoping to see more on research,
Really
right?
good.
And
Hope.
us advocating for our needs, not just caring for others, but advocating for ourselves.
Yes, yes, yes. And we can care for others better when we start with ourselves, for sure. That's a
Love that.
trickle down effect. Yeah. Well, thank you, Jaqueline. This has been amazing. A good
Thank
topic
you.
that's real important to be mentioned. And so, how can our listeners connect with you? And I'll
I think,
definitely list this in the show notes
yeah,
as well.
thank you. I think the easiest path would be through LinkedIn.
Mm-hmm.
I cannot too many social media. So the professional social media, I would say reach out, and if I can help, if I can clarify anything that has been published, I will be happy to do so. So maybe we can give some of the links to the studies
I sure
that
will. I sure will.
they can
Yes.
benefit from.
Yeah, and a chance to stay in the loop on the continued
Absolutely.
work that you're doing and the people that you're reaching, companies you're reaching, employees you're supporting. So very nice.
Beautiful.
Yeah.
Thank you so much. Thanks for having me.
You are welcome. And yes, and we hope this conversation spoke to you. And we definitely encourage you can reach out to me, and my listeners know how to contact me, abundanthealthwithmelissa.com. And I will link Jaqueline's information here. We would love to know what your experience is right now, what you are feeling in the workplace, whether it's with diabetes and menopause, or one or the other, or both, or whatever that looks like for you right now. I know Jaqueline would love to hear what is going on in your situation. And if you have any feedback about this conversation today, we would love to hear from you. That's why we're here. And share this this episode with other ladies that you know as well. So again, thank you. And we'll have you back when there's more things to talk about, more updates to share, because this is, like you say,
Absolutely.
this is an ongoing journey and study for you. And thanks again. All right.
Thank you.
You are welcome. Bye for now. Thanks for tuning in to the Type 1 and Midlife podcast. And be sure to subscribe, rate, and review right here on iTunes. And you're invited to connect with our Type 1 and Midlife community on the free Honey Health app. Here we discuss the podcast topics in a group chat, a chance for you to ask questions and take action on what we share here on the show. You can find the app link to download for free right here in the show notes. And for free resources, you can visit me at abundanthealthwithmelissa.com. And your support means so much. Thank you.